passion, and ever since then he has been decorating cities, malls and streets in other cities such as Delhi, Mumbai, Goa and Bangalore. So thank you for coming over and
चूर सैडल अंकल सर साइड में देख अच्छा अच्छा it's what a
nice to meeting me. I don't know him. He don't.
Carry a deep sense of gratitude to all the staff in this hospital. What you could manage during all the 3 waves of COVID was unbelievable, unthinkable. All the people of Bangalore and the surrounding areas are really grateful to the work you guys had put in during those testing times. My deepest gratitude to all the ambulance drivers, their helpers, the ward boys, the sisters, the unmatched doctors, fraternity that this hospital has got. You people really pushed your limits beyond human limits, I would say. Work non-stop for many days without going home. Even when your lab people were getting affected themselves, your lab never got dysfunctional for any period of time.
First case of Bangalore, COVID was detected in RR Nagar only, ward number 160. So everybody was afraid because it's a new disease, it's a pandemic. So that time I was in West Zone. I think you must have all, seen the TV clippings wherein 2-3 areas of Bangalore where we started sealing down the roads, areas and all. So it was so difficult, sudden kind of work for the health department, especially in BBMP, because it was not at all prepared. But we had a time of probably within 10 days. I should thank my state government for handholding us and supporting in all ways so that we geared up to the required level. And the first wave we could manage.
Hello, I am Dr. Gauri Shankar Reddy M. I am in charge of medical ICU. I was also in charge of COVID ICU during the COVID times here at BGS Gleneagles Global Hospital, Kengeri, Bengaluru. So we are commemorating the COVID anniversary, or felicitating and also recognizing the patients who have survived the COVID fight. We are also felicitating all the staff, healthcare workers who have fought, who have taken the burden, of fighting the COVID time. May it be doctors, nursing staff, security, housekeeping staff. So each and every person who has contributed during the COVID time is being recognized and remembered today on this day of World Health Day. So I would congratulate everyone.
Hi, I'm Dr. Siri Kamath, consultant physician, BGS Gleneagles Global Hospital. When the pandemic started, we had more questions than answers. We had no idea what treatment would work, what kind of investigations to be done for each patient. But we learnt along the way. I'm thankful to each and every member of our team. We have all worked equally as residents. There was no seniority or juniority while we worked, and somehow we managed. all three waves of the pandemic. So I thank one and all of my colleagues for putting in their best during this pandemic.
Abhishek M. I am a physician at BGS Gleneagles Global Hospitals. As we all know, this COVID-19 pandemic was a calamity on the entire human race. Only together with teamwork we were able to tide over this crisis, and I'm very happy to be associated with the management of COVID from BGS Hospitals. Thank you.
Dr. Shiv Kumar, Junior Consultant in the Department of Pulmonology. So I have been here for the past 3 years, and ever since I have arrived from the past 2 years, we have been having the COVID pandemic. It's been really a very tough time for all of us. But then we people as a team, we have successfully worked towards the betterment of each and every one over here. So I'm really happy to be a part of this team. So thank you.
I'm Dr. Abhijit, Associate Consultant Medical ICU, BGS Global Hospital. I'm working here for the past 2.5 years as an Associate Consultant in the Department of Medical ICU. And we had a tough time for the past 2 years dealing with COVID pandemic. And I'm very thankful to BGS for being associated with this hospital. And we were able to successfully manage the COVID pandemic.
I'm Dr. Yuvraj, Junior Consultant in Critical Care. Of course, we had a very tough time during COVID times treating all the patients. It's a very new experience for us, and hopefully we did our level best to save the patients' lives. And of course, we can save many people, but there is no regrets because we have tried our level best. Ultimately, it's a destiny. Of course, and as a treating doctor, we always were on our toes to treat all the patients to up to the level best.
Myself, Dr. Vishwanath Bellat, pulmonologist from BGS Gleneagles Global Hospital, Kangeri, Bengaluru. Today we are celebrating World Health Day. In the context of that, in our hospital, we are honoring the warriors of COVID. We know that for the last 2 years, the whole world has been reeling under the pressure of COVID. And in our hospital, all of us, including medical and non-medical support staff, everybody joined hand to fight this pandemic, and we could gain a success because of working as a team together from all the sectors of the hospital. And we thank every COVID warrior on behalf of COVID team. And also I thank the management and the media for their services that are rendered. Thank you.
My name is Kiran Upadhyay. I've been admitted as a patient in COVID ward for almost 2 months. This hospital has given me second life, and they have given the utmost best healthcare I can get. I will never forget this hospital and its service because it was like a family to me. I remember every time. Thank you very much.
Mahesh anta ಹೆಸರು 32 ದಿವಸ ICU ಲಿದ್ದೆ ಫಂಕ್ಷನ್ ಇದೆ ಕೋವಿಡ್ ಸರ್ವೈವರ್ಸ್ ಇದೆ ಅಂದರು ದಿಸ್ ವಾಸ್ ಅ ಆಪರ್ಚುನಿಟಿ ಫಾರ್ ಮೀ ಟು ಥ್ಯಾಂಕ್ ದೆಮ್ ಆಲ್ ಅದಕ್ಕೆ ಬಂದಿದ್ದೀನಿ ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್
ನಮಸ್ತೆ ನನ್ನ ಹೆಸರು ಕಾವೇರಿ ಅಂತ my dad was hospitalized, not me. He's 77 and when he was hospitalized he was clearly not in the best frame of mind, neither in best terms of when it comes to his health. All thanks to the tireless efforts, the sincerity, the commitment showed from the staff at BGS, because my dad has been able to completely recover because of his age. It was quite a tight scenario, and they have been extremely diligent in terms of ensuring that they not only put our worries at ease, but also were very open to ideas and suggestions. They did not address the situation in a dogmatic way, but rather they had a very holistic approach towards addressing the patient's health and his well-being. So this is something I'm extremely grateful for, because I just can't thank them enough, because my dad is where he is currently because of their efforts.